My name's Dr. Paul Morrison. I'm a senior lecturer at the Institute of Psychiatry, King's College London, and an honorary consultant at the Maudsley Hospital. Cannabis has been used for millennia, but it was only in 1988 that evidence emerged which showed that cannabis was a risk factor for the development of schizophrenia. Numerous studies have confirmed this initial observation, and since then efforts have focused on establishing which factors, whether genetic or environmental, interact with cannabis use to confer risk. And over the same time period, there's been an explosion in our knowledge of how THC, the main ingredient in cannabis, works in the brain. Cannabis is the most widely used illicit drug in the world, and various preparations are available, including traditional hash resin and marijuana, as well as more potent products such as sinsemilla, or skunk as it is better known. The main worry regarding the recreational use of cannabis is the risk to the user's mental health, specifically the risk of psychotic illness. It's long been known that in some users, cannabis can elicit a short-lived acute paranoid state, and it's also known that cannabis can worsen the course of a pre-existing schizophrenic illness in the form of a worsening of hallucinations and delusions, and sometimes people have to come back into hospital. It's also clear from numerous studies that schizophrenic patients who have a history of cannabis use go through their first breakdown at an earlier age, roughly about 3 years on average. Where there's been some controversy is around the issue of whether cannabis can actually cause schizophrenia in the first place. Since the original study in the late 1980s, there have been numerous reports showing an association between cannabis use and the risk of subsequently developing schizophrenia. Explanations such as self-medication with cannabis have been ruled out, and studies which track people over time show that cannabis use emerges before the onset of schizophrenia. Perhaps the most useful way to think of the association between cannabis and schizophrenia is in terms of an odds ratio. Overall, taking an average of the 8 or 9 studies that have been carried out, it's been shown that cannabis approximately doubles the odds of developing schizophrenia. Importantly, however, there appears to be a dose-response relationship, in that the more extensive the use of cannabis, the higher the risk. This was seen in the largest study to date, involving over 50,000 individuals, and people who had taken cannabis on over 50 occasions had 7 times the risk of developing schizophrenia compared to non-users. It's known that the use of cannabis is neither necessary nor sufficient for the development of schizophrenia. People can develop schizophrenia having never taken cannabis, and millions of people worldwide have used cannabis without developing a major mental illness. But the same can be said for cigarettes and lung cancer. It's perhaps more useful to consider cannabis use as a risk factor for major mental illness, in the same way that there are risk factors for cardiovascular disease.